The coronavirus that causes COVID-19 is called SARS-CoV-2, so that's the name of the virus. And COVID-19 is the name of the infection caused by that virus. And it's different from other coronaviruses because of the severe nature of the infection that it can cause and how easily it can be spread from person to person. So the most common symptoms of COVID-19 infection are fevers, respiratory symptoms, which could be anything from cough to shortness of breath or chest pain. Fatigue is very common. There are some other symptoms that have also emerged which can confuse doctors and patients as well. So these include nausea and vomiting, strange rashes, which can occur on your hands and feet, headaches, which could be more severe than the average headache potentially, muscle aches and other symptoms that are similar to the flu, as well as loss of taste and smell, which seem to be unique features of COVID-19 infections. So the most common way that COVID-19 infection is transmitted is from close contact with another infected person. So the close contact is really defined as about a 10 to 15 minute interaction within about 6 feet of that person and without individuals wearing protective equipment, especially masks. And most of the transmission events that have occurred in the United States and elsewhere have involved close contact in what we call congregate settings, which is close quarters with a larger number of people. So that could be a household, for example, or in the case of athletics, it could be gymnasium, locker room, schools, and other places where there are a lot of people in a relatively small area. The other method of transmission is what's referred to as fomites, which is infectious virus particles on surfaces. So those could be metal surfaces or others. Fortunately, we think that's a relatively less common mode of transmission, and cleaning surfaces well using alcohol-based or other products, it will help prevent transmission through that mode. So for all the teachers and students and student athletes and other students and other groups, it's really important to remember to wash your hands as much as you can. That could be with alcohol gel or soap and water. And really work hard to wear masks in those what we call congregate areas or close quarters. And that includes locker rooms and classrooms and other group settings where you're with 10 or more people at this point. Remember that when you're back in the community and doing your activities, wearing masks and washing hands and keeping your distance from folks as much as possible, at least 6 feet. Those are the 3 W's we talk about. Waiting and being patient, keeping distance for 6 feet, wearing masks and washing hands. Those things will all be really important for community members moving forward over the next several months.
Pardee will be screening students to participate in extracurricular activities. Each individual will complete a preliminary screening form signed by a parent or guardian. Athletic trainers at each school will designate a central location and time to complete daily screening checks for all individuals. All individuals will complete COVID-19 screening questions. All individuals will receive a daily temperature check. Student athletes and staff will receive a designated wristband indicating they are cleared for participation for the day. Cloth face coverings are required for all individuals unless participating in aerobic activity. If an individual presents with a temperature over 100.4 degrees or answers yes to any screening questions, that individual is not allowed to participate for the day. The athletic trainer will complete the screening form and provide the individual with information to follow up with the healthcare provider. The athletic trainer will notify a parent or legal guardian, as well as the necessary staff. Individuals then must have clearance from a physician in order to return.